Eastern Cape government has maintained that it's more than ready for the rollout. The province has the highest number of COVID-19 deaths in the country. An estimate of 3.7 million are targeted for immunization. To find out more on this, let's cross to our reporter Abongile Jantjies. Abongile, a very good morning to you. Just let us know about where you are and how the Department of Health in that province is preparing for a vaccine rollout.
A very good morning to you too, Desiree. I'm coming to you from East London, where we were scheduled to speak with the acting HOD for health here in the Eastern Cape, Dr. Abongile Jantjies. The vaccine will come at a time where the province has the highest deaths but the lowest active cases thus far in the country. 571 healthcare workers are currently being trained to carry out the work for the vaccine. Let's bring in now Dr. Zungu. A very good morning to you, HOD. Kindly tell us about the health workers. How will this rollout be for health workers, and how do you classify the people who will receive this vaccine here in the province?
Good morning, Abongile, and good morning to your listeners. In the province of the Eastern Cape, we have about 200,000 health workers, 60,000 of which are in the public sector. The other numbers account for health workers that are in private health facilities, that are in the private practitioners' rooms, private pharmacies, that are working in the community health work with NGOs, those that are working in the THPs, the traditional health practitioners. We are encompassing everyone that provides a service in contact with patients for the sake of improving the health of the person.
Doctor, the private sector, what's its role in the private healthcare sector? What's its role in terms of the vaccine?
When we look at the vaccination sites, we are going to use vaccination sites in the public sector, in the private sector, at universities. We have health sciences faculties at universities. In our province, we have 2 medical schools. We are going to also use the industries where they have occupational health clinics on site, where they treat their own workers when they are unwell. All those sites where health services are delivered are going to be used as vaccination sites in the phase 1. And then in the phase 2, we are then moving away from the health workers. But throughout the period of vaccination, we will be doing mop-up operations where some of the health workers might join health employment during the course of the vaccination, and they were not there when we started. We must always do the mop-up, and anybody who might have been left behind, maybe because of illness, because of pregnancy, because of any condition, the mop-up operation will continue all the way until we have vaccinated everyone in the province. For phase 2, we are then looking at frontline workers. Frontline workers are people like yourself who interact with the public, people who work, like for instance, till operators at retail shops, all those people who are there in front in government departments. We have a lot of people. We have departments like Department of Education, which has a lot of frontline workers. You go to the municipalities, you've got city police, you've got South African Police Service, you've got a lot of people who are frontline workers. And in the second phase also, we look at all the people in the province who are above 60 years of age. And then we look at people who are above 18 years of age who have comorbidities. Then we look at people who are in congregate settings, people who are like in safety homes, people who are in correctional services facilities. All those people need to be catered for because they do provide an easy way for the virus to spread. So they need to be given the immunity so that when the virus comes to them, it cannot get through to them and they cannot also spread it.
I understand that you are utilizing churches, schools, and community centers as vaccination sites. But how do you ensure that what challenges are you foreseeing with this with the rollout of this vaccination?
The challenges I'm seeing, the first one is the issue where there is reluctance to take up the vaccine. So that's the first challenge, because here you are with individuals who have an opportunity to get the vaccine, but they are not yet comfortable to take the vaccine. So as a department, as a province, we are continuing our messages to make people aware that this is one of the very big weapons that we have against the virus. The second challenge that we have is that we need people to pre-register for the vaccine. The phase one is health workers, and the National Department of Health has created an application where health workers can register themselves so that when they are ready to be vaccinated, their names are already there. And it makes it easy to account for the doses of the vaccine when you know how many people are to be vaccinated that are registered, and then the doses are released to the province. The third challenge that we have is that we have private practitioners in the sense of any other person that is practicing something related to health. We don't have a database, unlike the ones employed by the private sector, health facilities, or those that have medical associations and so on. When we come to our traditional health practitioners, the customary surgeons and the others that will be interacting and interfacing with people, we do not really have those. We also need to get to the funeral parlors and ensure that we have their people well registered so that they can also get through in the first phase. And then the fourth challenge that we have is the vastness of our province. It's vast, with a sparse settlement pattern, with areas that do not really have good connectivity. So we then need to devise strategies that are custom-made for our province so that there is no one left behind when the vaccination time comes. For phase one, it's health facilities, it is much easier. But that is going to be difficult when we get to phase two and to phase three, where we cover everyone in the province.
A lot of money will be spent in terms of this vaccine, and there was COVID corruption. A lot of money has been looted, one might say, but how do you ensure that this is free of corruption?
The systems that are being used, first of all, when we receive the vaccine itself, all the procurement would have been done centrally. What we need here is ancillary supplies like syringes, needles. Those things are already things that we use in our day-to-day life. So it's not like there's going to be something new that we have to go all out and procure. The vaccine fridges, we have them. However, we need to check how many that we have. Will they be enough for the volumes that we are going to be dealing with? And again, those things are things that we buy. We already have existing tenders. We'll just go to the existing tenders to bring in those.
As you say, the Eastern Cape is a vast province, and the roads aren't that well. Won't that have an effect in terms of this vaccine?
It definitely will have an effect. However, what we have already started doing, we have started the consultative work with the district municipalities, where we are going down to the ground up to ward level to understand the terrain in the Eastern Cape and also to understand the available facilities and the infrastructure like water, sanitation, electricity, because we can then have a generator or bring in the water to ensure that a structure that is not quite suitable can be made suitable for the vaccine. Because if you go to the far-flung areas, the only structure that you might find there might just be a school. And if you look for a structure that has all the things ready there, it might mean we are putting pressure for out-of-pocket expenses for the person who must move from that area, maybe 20, 30 kilometers to another facility.
How are you encouraging people to take the vaccine? And there are calls that leaders such as premiers, mayors, and traditional leaders should be the first to take the vaccine. What's your take on that?
My take is any individual that carries the weight and the influence that can be respected by our communities should really come forward to send the clear message that this is what we need as a people. When a leader takes the lead on something like the vaccine, something that has been surrounded by controversy, it is much easier to say, because my leader is now there, then I can know that this is something I can do. It would be a very good gesture if the leadership can come forward and take on the vaccine.
When can we expect the vaccine to be in the Eastern Cape?
I am very hopeful that probably in the next 2 to 3 weeks, the minister has made the announcement that the plane will be leaving India today, and we are hopeful that in the country we will have the vaccine by the end of the day, maybe tomorrow. And after that, the vaccine will have to undergo all the quality controls and meet the regulations of the country. And after all that is done, which maybe will be 2 to 3 weeks, and then get delivered to the province, it's all system go for the health workers. We are ready. Our health workers are ready for the vaccine, and our facilities are ready. Our storage areas are ready. We are just eager to receive the vaccine.
I thank you so much for your time.
Thank you.
Well, Desiree, we'll have to leave it there as the HOD, Dr. Abongile Jantjies, has another commitment to attend. Well, as the plane has left for India, people are waiting anxiously for this vaccine, and hopefully it will improve the lives of the people here in the Eastern Cape. From us here in East London, myself, Abongile Jantjies, and my colleague, Vaccination, it's back to you.
Thank you very much, Abongile. On to a different story.